Hello, everybody. This is Dr. Jafri. I'm a board certified gerontologist, and today I would like to talk to you about this pink form. This is a form regarding medical decision making, and unfortunately, not every most patients don't have adequate knowledge about this form. This is called the Molst form, or Medical Order for Life Sustaining Treatment. This is a form in New York State where patients are allowed to make medical decisions regarding limitations on their health care. There are about A to E sections, and I'll go over each and every section, but the gist of it is whether you want to have resuscitation or no resuscitation, and whether you can consent for resuscitation, and the other important facts is whether you want to be kept alive on a breathing tube. So those are the main ones, and there are a few other points which I'll go over. So Section A of this form, which your doctor will go over with you, is regarding resuscitation, whether you would like to have a CPR, which basically means that you would like to have your heart restarted, and most of it is basically compressions, chest compressions, or be a do not resuscitate, meaning allowing natural death, meaning your heart has stopped naturally to let you go in peace. That's Section A. Section B is the consent for the resuscitation, and Section C is the physician or a nurse practitioner may be able to sign this. Section D shows who is actually making the decision, whether it's a healthcare proxy, the patient himself, a living will. Section E talks about, this is Section E, it's page 2 of this form. It discusses whether you would like comfort measures, limited medical interventions, or no intervention at all. So, question number 1 there is whether you would like to be a do not intubate, meaning you do not want to be kept alive on a ventilator or have a ventilator placed at all. Point number 2 is you can have a trial of ventilatory support. For pneumonia or an infection, if you want to be on a ventilator for a certain amount of time while decisions can be made about your health care, that is a trial. And the third instruction on the ventilatory support is whether you would like to try the non-invasive support, such as something called BiPAP, which basically pushes air in, but is not a ventilator. There are other questions regarding whether you'd like to be transferred to the hospital or not. Some people would like to be comfort-oriented, so therefore would not be sent to the hospital. The other one is regarding fluid and nutrition through the IV, whether you're somebody who would like a feeding tube placed or you would like IV fluids. And the last question in this form is regarding antibiotics, whether you would like antibiotics used if you can make decisions on your own or not. And then the physician or nurse practitioner signs this. So like I said, this is a 2-page form and this can be renewed every 60 days, especially in a nursing home. You have to review it about every 90 days, and if the physician signs it, if there's any changes to it. And once it's signed, this is a medical order and it's legal paperwork. And this is a very important form that will speak for you if you can't speak on your own, whether you're sick or you have mental illness going on along with confusion. This will speak for you, and most people put it on their home refrigerator because by default, if they find you unresponsive, they're supposed to start CPR and keep you artificially alive unless they have a form like this. And this is usually reviewed with the patient if he has capacity at hospital admission and nursing home admission. And if there's any other questions about this form, you can write it in the comments and I'll try my best to answer.